newly appointed as our independent chair of the Adult Safeguarding Board. And I know that a number of you in the audience were here as part of that interview process, which I think you may share was quite a gruelling one.
Yes.
So it's my delight to hand over to Jane. Thank you.
Right. So as both said, so I was suffering a bit from hay fever, but my name's Jane Geraghty, and yes, I've just started in Bradford. In fact, it's my third visit to Bradford since I got this job. And I'm absolutely thrilled that my first kind of big event is here with you. Because I said when I was interviewed, and it's absolutely true, that my highest priority, and sadly in some ways it has been for decades, is to hear the voices of experts and listen and respond to and take notice and change things because of what you tell us. So I'm so thrilled to be here today to sort of be my first big outing in Bradford. Now, you will remember Jonathan, I think, who was the chair before me, and he's actually can't be here today, but he does send his very best wishes, and I hope to have a very seamless sort of change of authority from Jonathan to I, but the same commitment that he showed to meeting with you and working with you, I will guarantee I will pick up on, and if you're not happy with my approach or whatever, then you just simply have to tell me and I'll take it on the chin and I'll change and do things differently. So my role is to make sure that the partners in Bradford, and the key ones are the police, the local authorities and health and the voluntary sector, deliver absolutely excellent safeguarding services in their own organisations, but also that they work together to do the same. So there's no scope for people sort of shirking their shoulders and saying it's somebody else's responsibility. It's absolutely everybody's responsibility in all the organisations in Bradford. Now, I've previously chaired boards in Durham and Leicester, and I suppose Leicester City has some similarities in terms of the demographics of Bradford, so I have some things to share, but Bradford is unique and I'm really looking forward to hearing about all the issues. Now, two things that the board has to do because of the Care Act is to produce a plan every year which identifies what our priorities are, and then at the end of that year I have to produce a report that says, this is what we said we'd do, this is what we've done, this is the impact of what we've done, and this is what we need to do next. And I have to be grilled by you and by lots of other people, the Health and Wellbeing Board and the scrutiny committees, about, well, did you do what you said you were going to do, and did you make Bradford safer? So it's a big ask, but we're going to work on it together. So, as I've said, it's absolutely important. You are the experts. You are people who either are users of services or carers, and you have so much to tell us about what we're doing well and also what we're not doing so well. So I'm really committed to listening to you and then doing something about what you tell me. And this is a unique opportunity today for you to feed in your ideas about next year's plan, or no, this year's plan. And also want you to spread the word in all the organisations, in all the geographical areas and the groups you're linked to about the nature of abuse, because it's so widespread. It keeps what we recognise as abuse keeps changing, and we need you to help to tell people what abuse is so that people don't live with abuse thinking it isn't abuse or it's acceptable. So you are the experts, and we're going to be coming to you increasingly to ask you to help us. So we do need your help specifically today in helping us identify what we're going to prioritise next year. And you've got something in writing about some of our ideas. They're not bound to be right, and certainly throughout the day we're looking to hear from you what perhaps we ought to prioritise that we may not even have thought about yet. So I know last year there was a conference and over 200 people attended, and you told us that you wanted us to do more about mate crime. Can you not hear? Sorry, mate crime. And you're going to hear more about that today. There's going to be a film, and you're going to hear a lot more about it, but we particularly picked up that issue because you told us last year that we needed to do more. And then we're going to tell you more during the course of the day about what our priorities should be. And also there's an opportunity for an online consultation that I'm sure Nima will give more details about later. And there's a box if you're still on paper and pen and you want to stick things in the suggestion box, well, please do that. So gather all your ideas together. Oh, sorry. Right, so what I'd like to do is to receive invitations from all of you to come out to your place. I don't need much more than a cup of coffee, and I'll come, and I want to come out and talk to you and hear from you about what's really worrying you and what we need to do something about. So please send in the invitations, and maybe I can take some away some today. And again, I want to endorse what the two previous speakers said, Mark and Bev. That would be my approach. I mean, I really like what Bev said to you about her approach, and it's something I absolutely agree with. Life is about having fun. You know, there's too many serious things. We have to be serious, but we want every individual to have a unique, fulfilling and creative life, and we want to support you in doing that. So thank you so much. Can't wait to start talking to people and waiting for the invites, and really looking forward to the rest of the day. So thank you.